Hello again, viewers, subscribers, and our moms out there who have been watching my videos. I hope they've been helpful, and please don't be shy or hesitate to message me on Messenger on my Facebook page, Physio Mom on Facebook, if you have any questions that you want to ask, or if you feel like you have any uh, customized needs that you think I haven't covered properly in my videos that you might have queries about, please don't hesitate to message me on Facebook as well. Okay, so this video is going to be about postnatal physiotherapy, exercises that you should do after you give birth. And why we do exercises after we give birth, it's mainly to help your body get back to what it used to be before you got pregnant, before your body changes started to affect you, and also just to help you recover well after you give birth, and also to promote healing in your body. And it also helps you to feel good about yourself as well. Postnatal depression is something that we hardly consider or hardly talk about here in Fiji, and something that we always think that does not exist, but it is very real. And exercises help lift your mood very much, helps you feel good about your body as well. So yes, one a few tips about postnatal physiotherapy. It helps you strengthen your pelvic floor muscle, as I explained in my latest video before this one. Keeps your pelvic floor muscles strong so that you don't have urinary incontinence. It also helps prevent lower back ache, and it also physiotherapy exercise also helps you restore your body and also your wellness as well. This also helps improve your mood, as I had explained before, and helps to relieve stress as well. The first group of exercises that I'll be talking about will be about exercise that you need to do, or mobility that you need to practice, safe mobility that you need to practice after you have a cesarean, that is a C-section. So not a normal vaginal delivery, but when you have a C-section, when there's an incision that is made in your abdomen to help remove baby because of maybe complications that you might have had, or baby was too big to be delivered through the vagina, so that your doctors probably had advised you to believe that you were going to have a C-section. So some things that you need to remember is that come out of surgery, or you have had your C-section, and one thing that we always advise moms is about coughing. Sometimes you'll feel the need to cough because you've just come out of surgery, so coughing and sneezing as well, these are some things that happen, and in order to avoid discomfort, we usually encourage moms to support their wounds. If you feel like you need to cough, as I had explained, wound support. So supporting your wound when you cough, so you can get a towel or a sheet like this, or a small pillow, push and keep it with you next to your bed. So if you feel like you need to cough, you support your wound with your wound will either be this way, depending on what the doctors decide, or it'll be this way, right? So support your wound wherever it is, support your wound, and then cough, or sneeze, right? So support your wound. It will help you minimize pain, and it help feel less heavy when you cough or sneeze. And also, when you get up and out of bed, I will demonstrate this. It's important to always support your wound when you get up and out of bed. Okay, so if you're lying in bed and you've had a C-section, one good way to get out of bed is, as I explained, supporting your womb. All right, knees up. Okay, and then you turn to your side. Turn to your side, knees up, turn to your side. And then after that, you can use one hand to support your wound. If you have someone to help you get up, that's good. But if you don't, support your wound, use one hand, and push yourself up this way. Always supporting your wound. Once you're up here, then you can swing your legs over, right? Support your wound and get up slowly, right? Always support your wound, always turning to the side and then sitting up, okay? If you lie down and then you get up, this way you will put stress on your abdomen, and you can also re-injure yourself. Your next exercise is the most important one, breathing exercises, okay? So because I had explained in my first video, baby is pushing up against your diaphragm during pregnancy, so you get a lot of shortness of breath easily. So after you deliver baby, after your C-section as well, and after your normal vaginal delivery, you can start and go ahead with your breathing exercises. These exercises are really good. It helps your lungs get used to your old lung volume as well. It helps you increase your air entry and oxygen intake, helps your body heal quickly as well, and your lungs are back to expanding and contracting as they would normally contract and expand before you got pregnant, right? So this would be a really good time to just start with your breathing exercise. Yeah, so relaxation breathing in through the nose and out through the mouth. When you breathe out through the mouth, whistle. It's like you're whistling. This way it controls the air that comes out of your mouth as well. So in through the nose and out through the mouth. The next exercise, breathing exercise that I wanted to teach you guys is called active cycle of breathing. So this active cycle of breathing technique is usually a good breathing exercise that we teach our patients. It will help increase air entry, and it also helps take out any mucus. Like, it will induce a cough. If you have any mucus inside your chest, it will help take out the mucus. So this exercise is important if you've come out of an operation, if you had a C-section, because what happens when you go into an operating theater, when you have a surgery, is usually they put you to sleep. So when they put you to sleep, your muscles go to sleep as well. So your throat muscles, they go to sleep, your chest muscles as well. And because of the anesthesia, what happens, most patients, when they wake up from anesthesia, they usually feel like they want to cough, or simply because their muscles were at rest. So that also causes the mucus inside your lungs, or any saliva or anything like that, to also be stagnant. There's no activity in your muscles to help you cough out the mucus, or your saliva gathers in your throat, or so it goes down into your airways. That's why it's important that we teach moms breathing exercises when they come out of a cesarean section. So this exercise, ACBT, it's called active cycle of breathing technique. So one cycle composes of two breathing techniques and one half. So the number of times you're going to do the breathing techniques, I'll be also showing it in the next slide. So you'll have 6 deep breathing exercises. So 6 deep breaths in and out. When you breathe in and out, a good way to make sure that you're breathing properly is to make sure that when you breathe out, your tummy goes in, right? So it helps push all the air out. When you breathe in, your tummy comes out. Okay, push your tummy out, because that will help maximize all the air that goes into your lungs. So tummy out when you breathe in, and tummy in when you breathe out. So you'll start with 6 of those, and then you'll do 4 sustained maximal inspiration. So 4 breaths in while holding your breath. So it'll be, hold your breath, count to 5. 1, 2, 3, 4, 5, and then, right, there'll be 4 of those, and then you'll go back to 5 breathing with your diaphragm, stomach in and stomach out. So 5 deep breaths in and out, no holding your breath. And then after that, you'll go into 3 holding of your breath. So 3 deep breaths and then holding your breath. So count to 5, and then we're going to do that 3 times, and then you're going to go into 2 times deep breaths in, stomach out, and then your last one is the half. So this half will be like just like a cough, but you're forcing the air out. So breathe in and then right. What this does is, if there's any cough or if there's any mucus inside your lungs or inside the airways of your lungs, it will help you force the mucus out, and it will be easier for you to cough out. What these exercises do, the cycle of breathing, different types of breathing, your deep breath in and out, right? That one, it helps you maximize air in. When you hold your breath, When you do that, what it does is all the air that you're breathing in, it will go into the deeper parts of your lungs, deeper parts of your little airways inside your lungs. It will go deep in there. So if there's mucus along the way, it will go behind it, and the air will go through it and go behind it. It go into the smaller airways of your lungs. So once you do the half, if there's air already behind the mucus, what it does is that air will try and push out the mucus. So that will help mobilize the mucus out, so that when you cough, the mucus comes out, right? This is an exercise that you can do after you come out of surgery. You're lying in bed, it's safe for you. And remember, it's important when you do your half, support your wound, as I had explained. Support your wound and half, okay? And other moms as well, if you're finding it hard to breathe, or you're finding it if you're having a cough or just shortness of breath still, this is a good exercise as well. It's easy and it's not going to make you too tired, right? But red flags, important thing is to remember, if you start feeling dizzy, you start getting a headache, you stop, right? Don't do the exercise, breathing exercise, if you feel dizzy or if you have a headache.
I wanna be tried, purify me, and take whatever you desire. Oh Lord, so clean my hands, purify. I wanna take my life as a living sacrifice. I wanna burn only, clean my head. Please purify my mind. I wanna burn, I wanna burn, I wanna burn, I wanna burn, I wanna burn. Thank you, Jesus. Thank you, Jesus. I wanna burn. I wanna burn. I wanna burn. Clean my head.
In my last video, I probably did not explain properly to you about abdominal squeezes. So this exercise is also good for when you are pregnant, and also after you give birth. It will help you start waking up your tummy muscles again. It will also start helping you get into the process of doing your abdominal exercise, abs exercises, toning your abs, or trying to make sure that healing is also uh, helped. It helps along with your healing as well as your body recovers from giving birth. And for those of you who do get cesarean C-sections, this is also a good way to help your wound heal. So depending on how the doctors will make any incision, it'll either be this way, vertical or horizontal, depending on the situation of your baby or your health or anything like that. So they will either cut vertical or horizontal this way. But either way, it's important that you always support your wound. You can support your wound and also start with your abdominal squeezes. So just like when you're trying to fit into jeans that can't fit you anymore or that are getting too small, you suck your stomach in, right? So that's an abdominal squeeze. So you just hold on to your tummy, support your wound with a cloth or bed sheet or anything, a pillow that I had shown you, and you slightly squeeze, just squeeze, and then you hold for about 5 seconds. 1, 2, 3, 4, 5, and then relax, right? There will be pain, especially if you have had a C-section. There will be pain, but a small squeeze will definitely help. It will help circulate blood into your wound and also help you recover quickly. If you have given birth and you had a normal vaginal delivery, this is also good, because after baby is out, you'll have a mommy pouch, so like a tummy pouch here. So this is a good way to get your stomach toned again, to get you to start doing those exercises. And so this is a good abdominal exercise. Don't go straight into sit-ups after you give birth, because that's not good. You'll get tired, your body's still recovering. So one good low intensity ab workout is just squeezes. So squeeze, hold for 5 seconds, and then relax, and squeeze again, 5 seconds, relax, squeeze, relax. Right? And also a good exercise you can do is leg raises. Leg raises also helps with your abs. So just lie flat on your back, and then you just raise your legs straight. Leg raises. So your legs are straight, and then you just 1, 2, 3. Try and do 5 for each leg. That's a good low intensity ab exercise. So tummy squeezes and also straight leg raises. Remember your red flags: anything that makes your head sore, makes you feel dizzy, shortness of breath, you stop, right? This next exercise is bridging. If you are finding it difficult to get out of bed or turn in bed, you can start with bridging exercises. They will definitely help you start mobilizing out of bed. And also, it helps with your quads and hamstring strengthening as well. Straight leg raises, as I had explained already, just lying flat on your back and raising your legs straight. You can do 3 or 4 on each side, and then switch to the other leg as well. Side leg raises, you can turn to your side and also do these exercises. These exercises are very ideal for when you are lying in bed after surgery or after giving birth. Last but not least, back care and posture, always important. Before delivery, after delivery as well, very important. These back care and posture I had demonstrated in one of my videos, I think my second video. So if you are watching this for the first time, go to my YouTube channel, Physio Mom. You will see a video on back care and posture. Those are good guidelines for you to follow, especially during a pregnancy, and also after you give birth as well. So yes, those are some exercises that you can do after you give birth and after your delivery. These exercises, I hope that they will be helpful to you. And also, if you have any questions on how many you can do, or if you're finding it difficult to do those exercises, or if you have any questions and all about the exercises, you can message me on the Physio Mom Facebook page. There's a messenger button there. You can just click on it and message me on on that page. And also, if you have any questions about those. So yes, a short recap on what we have covered in this video. What your exercise that you need to do for labor, after labor and delivery, your pelvic floor muscle exercises, lower back and posture care, as already explained in my earlier videos, wound support and coughing, how to support your wound and how to cough with after you've had a C-section, how to get out of bed, um, abdominal squeezes we've done, breathing exercise, your relaxation breathing that you can do, and also your active cycle of breathing technique. That's a good exercise. Bridges, side leg raises, and straight leg raises. And last, yes, and your pelvic floor muscle exercise. Remember, your pelvic floor muscle exercise is very important. After your delivery, whether you had a C-section or normal vaginal delivery, it's important that you start straight away with your pelvic floor muscle exercises. They're really good. And it also helps prevent backache later on as you're recovering as well. And remember, it's important not to do any heavy lifting. Anything that you do, try and get somebody to help you if it's heavy and you need to lift it. Remember that your back care is very important. Always lift with your knees bent and not with your back, right? As I had explained in my earlier videos. But thank you so much for listening, and for if you've reached this end of the video, thank you so much for listening, and take down some notes of the exercises that I've been teaching you so that you can do it at home. And remember, your red flags is very important. If you have a headache, if you have bleeding, if you feel dizzy, shortness of breath, you stop your exercises, okay? And congratulations again if you've given birth and you have your baby with you. I hope my videos on labor really helped you with your delivery. And if you haven't delivered yet, I hope my videos are helping you with preparing yourself for labor. Thank you and God bless.